Welcome to our comprehensive guide on upper limb joint mobilization. In this video, we'll explore the anatomy, movements, and essential mobilization techniques for the shoulder, elbow, forearm, and wrist joints. Whether you're a student, therapist, or simply curious about how our arms move, this journey will help you understand the mechanics and practical approaches to improving joint function and reducing pain. Let's begin by setting the stage with a brief overview of why joint mobility matters and how these techniques can enhance daily activities, sports performance, and rehabilitation outcomes. Get ready to dive into the fascinating world of upper limb anatomy and movement. Let's start with the shoulder joint, also known as the glenohumeral joint. Proper patient positioning is crucial for effective mobilization. The patient should lie prone, with the shoulders slightly abducted and positioned at the edge of the couch. This setup allows for optimal access and movement. To prevent unwanted scapular motion, a belt can be used for fixation. The forearm and hand should hang freely, and folded towels can be placed under the coracoid process and anterolateral chest wall for support. This careful arrangement ensures both comfort and stability, setting the foundation for successful mobilization techniques. Now, let's focus on the therapist's role. The therapist should stand beside the patient, facing the glenohumeral joint. The right hand is placed on the proximal humerus, while the left hand holds the lower arm. To mobilize, traction is applied with the left hand, and the right hand glides the humerus in a ventral direction. This coordinated movement helps improve joint play and can alleviate pain or stiffness. Remember, clear communication and gentle handling are key to a safe and effective session. Moving on to the elbow joint, let's break down its anatomy. The elbow is a synovial hinge joint comprising the lower end of the humerus, convex, the head of the radius, concave, and the upper end of the ulnar, concave. Key ligaments include the ulnar and radial collateral ligaments, which provide stability. Understanding these structures is essential for effective mobilization and injury prevention. The elbow allows for flexion and extension, powered by muscles like the biceps, brachialis, triceps, and anconeus. Let's see how these components work together to enable smooth arm movements. Let's explore the movements of the elbow joint and their arthrokinematics. Flexion involves medial and lateral gliding at the ulnar joint and ventral gliding at the radiohumeral joint. Extension, on the other hand, features medial and lateral gliding at the ulnohumeral joint and dorsal gliding at the radiohumeral joint. Abduction and adduction are associated with medial and lateral gliding, respectively. These subtle joint mechanics are crucial for full range of motion and functional activities like lifting or throwing. Recognizing these patterns helps therapists target specific restrictions during mobilization. For the ulnohumeral joint, distraction and gliding techniques are commonly used. The patient lies supine or sits with the elbow in a resting position. The therapist fixes the arm and applies a long axis distraction force at about 45°4 flexion. Medial and lateral gliding can be performed to increase joint play, reduce pain, and improve both flexion and extension. These techniques are especially helpful for patients with limited elbow movement or discomfort after injury. Always ensure the patient is comfortable and the joint is well supported during mobilization. The radiohumeral joint also benefits from distraction, dorsal, and ventral gliding. For distraction, the therapist grasps the distal humerus and pulls the radius downward. Dorsal gliding increases elbow extension, while ventral gliding enhances flexion. These techniques are performed with the patient supine or sitting, ensuring the distal humerus is stabilized. Proper hand placement and controlled force are vital for safety and effectiveness. These mobilizations can help restore normal movement and relieve joint pain, especially after trauma or repetitive strain. Let's turn to the radioulnar joints, both proximal and distal. Dorsal gliding at the proximal radioulnar joint increases pronation, while ventral gliding enhances supination. At the distal radioulnar joint, both dorsal and ventral gliding are used to improve pronation and supination. The therapist stabilizes the ulnar and mobilizes the radius, with the patient in a comfortable supine or sitting position. These techniques are essential for restoring forearm rotation, which is crucial for tasks like turning a doorknob or using tools. The wrist joint is a synovial ellipsoid joint formed by the lower end of the radius and the proximal row of carpal bones. Key ligaments include the ulnar and radiocollateral ligaments, as well as palmar and dorsal radiocarpal ligaments. The wrist allows for flexion, extension, ulnar deviation, and radial deviation, powered by a variety of muscles. Understanding these structures and their functions is vital for effective mobilization and injury prevention. Let's see how these movements contribute to daily hand function. Wrist mobilization includes distraction, ventral gliding, dorsal gliding, ulnar gliding, and radial gliding. Distraction increases joint play and reduces pain, while ventral and dorsal gliding target extension and flexion, respectively. Ulnar and radial gliding help improve deviation movements. The patient sits with the wrist at the edge of the couch, and the therapist stabilizes the forearm while mobilizing the hand. These techniques are especially useful for restoring wrist mobility after injury or prolonged immobilization. The thumb's carpal metacarpal joint is a saddle-type synovial joint, allowing for a wide range of movements: flexion, extension, abduction, adduction, and opposition. Mobilization techniques here include distraction and specific gliding maneuvers to enhance mobility and reduce pain. The therapist stabilizes the trapezium and mobilizes the metacarpal, with the patient's hand supported on a table. These techniques are vital for maintaining thumb function, which is essential for gripping, pinching, and fine motor tasks. To wrap up, joint mobilization of the upper limb is a powerful tool for improving mobility, reducing pain, and restoring function. Always prioritize patient comfort, proper positioning, and gentle, controlled movements. Understanding the anatomy and arthrokinematics of each joint allows for targeted and effective interventions. Whether you're working with athletes, patients recovering from injury, or anyone seeking better arm function, these techniques can make a real difference. Thank you for joining us on this journey through upper limb joint mobilization. Stay curious, keep practicing, and help others move better every day.